Good afternoon, and thank you for joining us today in this Image Challenge Livestream event from Retina Physician. My name is Mari Rodriguez, and I'll be your host today. I'm a retina specialist with Richard Retinal Associates, and I practice in Massachusetts. I have no financial disclosures. As you know, our plan is to post an image challenge each month and then discuss the diagnosis and management using this platform. We would love to hear your thoughts online. You can find us on Facebook, LinkedIn, YouTube, and Twitter. You're also welcome to write on the chat and share your thoughts with us during this event. Today, we will be discussing the case of a 45-year-old gentleman with no visual complaints who was referred to our clinic for an evaluation of maculopathy in the right eye. His vision was 20/20 in each eye, and he had normal intraocular pressures. And on slit lamp examination, he had a normal anterior segment with very minimal nuclear sclerosis. Examination of the posterior pole demonstrated a flat, hypopigmented, torpedo-shaped lesion temporal to the macula with a small hyperpigmented tail. Then when we did the fundus autofluorescence, we see a hyperfluorescent border surrounding that hypoautofluorescent area of atrophic retinal pigment epithelium. The OCT demonstrated a lesion with loss of ellipsoid and interdigitation zones, as well as outer retinal cavitation and inner choroidal cavitation. At this point, based on our imaging findings and the OCT, we suspected torpedomaculopathy. Torpedomaculopathy is a rare benign lesion of the RPE, which usually is diagnosed incidentally, and it was first described in 1992 by Rosnan and Gass. The prevalence is about 2 in 100,000, and it has a slight female predominance. The pathogenesis of the disease is unknown, but this congenital defect is thought to be either developmental deficiency in the nerve fiber layer or persistent developmental defect in the RPE of the fetal temporal bulge. The differential diagnosis includes a choroidal scar, trauma, chirpy, an RPE hamartoma, or other retinal dystrophies. In general, these lesions remain stable over years, and because of that, we decided to follow this patient yearly. However, there's also an increased chance of choroidal neovascular membrane formation compared to the general population. So because of that, we decided to give the patient an Amsler grid for self-monitoring at home, and he'll be seeing us yearly. So thank you for tuning in today. You can leave us a comment online via multiple platforms, and we hope to see you again in about a month as we discuss another interesting case. Thank you.